Okay, so today we talk about CEAP classification. So CEAP is clinical, etiological, anatomical, and pathophysiological classification for venous diseases. So first we learn about clinical classification. So we have C0 to C6. So C0 is no venous disease. C1 would be telengiectasia and reticular or reticular veins. So now what exactly is telengiectasia? Telengiectasia is less than 1 mm diameter intradermal venules. So telengiectasia is less than 1 mm intradermal venules, and they are also known as spider veins, thread veins, and hyphen webs. Spider veins, thread veins, and hyphen webs. Next, what is reticular veins? So reticular veins are 1 to 2.9 mm diameters subdermal venules. So we've learned about telangiectasia and reticular veins. Now C2. So what is C2? C2 is varicose veins. What are varicose veins? So varicose veins are dilated subcutaneous veins of more than 3 mm diameter with intermittent blowouts and reflux present. So what are varicose veins? They are dilated subcutaneous veins of more than 3 mm diameter with intermittent blowout and reflux. C3 would be edema. So what happened? Smaller veins turned into larger veins, then edema. C3 edema. C4A is hemosiderosis, which is pigmentation, or eczema, or corona phlebectatica. So let's know what all of them are. Hemosiderosis is brown pigmentation. And second is it is permanent. It cannot be treated. Eczema. What is eczema? Eczema is an erythematous dermatitis. Erythema means reddish discoloration, and second is it causes itching and irritation. So we know eczema if there is an erythematous dermatitis. And third is corona phlebectatica. Corona phlebectatica. So what is corona phlebectatica? It is malleolar flare, and the characteristic fan-shaped pattern of telangiectasia over foot or ankle. So this is the real definition: fan-shaped telangiectasia over the foot or ankle. C4B. Now what is C4B? It is lipodermatosclerosis or atrophie Blanche. So we've missed out one thing in corona phlebectatica, that is, it is an early sign of advanced venous disease. So corona phlebectatica is an early sign of advanced venous disease. Now let us know what is lipodermatosclerosis and what is atrophie Blanche. So what is lipodermatosclerosis? So chronic inflammation of skin and fibrosis of skin or subcutaneous tissues is lipodermatosclerosis, and it is a sign of advanced venous disease. And it is tight contracted woody leg on examination. So when we examine, we'll find a tight contracted woody leg in lipodermatosclerosis. What is atrophie Blanche? Atrophie Blanche is localized area of atrophic white skin. Localized area of atrophic white skin surrounded by inflammation, pigmentation. So we've learned about lipodermatosclerosis and atrophie Blanche. What is C5? So C5 is a healed venous ulcer. And what is C6? C6 is an active venous ulcer. So healed venous ulcer, then active venous ulcer. Now what is a venous ulcer? Venous ulcer is full thickness skin loss is venous ulcer, and there are high chances of recurrence. So the clinical part of the CEAP classification is complete. Next we learn about etiological classification. So how do we classify venous disease etiologically? So EC is congenital, EP is primary, ES is secondary, and post-thrombotic, and EN is no cause identified. So basically EN congenital and primary and secondary, post-thrombotic. So anatomical classification now. So we have superficial, perforators, deep, and no venous disease, no venous location identified. This is anatomical classification: superficial, perforated, deep, no venous location identified. Then pathophysiological classification. So how do we classify pathophysiologically? We see reflux, obstruction, or both. Reflux and obstruction. And then there is always this PN, no pathophysiology identified. So this completes our CEAP classification. with all the required definitions of telengiectasia, reticular vein, corona phlebectatica. So now let's see the images also. So this is telengiectasia and reticular veins from Bailey, figure 57.4. Then we can see advanced skin changes, lipodermatosclerosis, eczema, atrophie, Blanche, white discoloration. This is hemosiderosis in figure 57.7, brown pigmentation. This is severe eczema, erythematous dermatitis, and this is mild lipodermatosclerosis, and this is full-blown venous ulcer. So let us go through the images once again. Telengiectasia and reticular veins in 57.4. So these are smaller veins, less than 3 mm in diameter. And this is the saphenopharynx. This is advanced skin changes, lipodermatosclerosis, eczema. Eczema is erythematous dermatitis. 57.7 figure is pigmentation, hemosiderosis, and this is severe eczema, which is erythematous dermatitis. This is lipodermatosclerosis and hemosiderosis. This is brownish pigmentation, and this is varicose venous ulcer. In the next sessions, we'll learn more about varicose veins. Thank you.